Hello, I'm Dr. Upasana, Consultant Internal Medicine, Manipal Hospital Whitefield. It's a general notion that vaccination is only for children and not for the grown-up. However, it's not so. Adults need vaccination as much as the children need, because as we grow up, our immunity wears off the vaccination which we have got from the childhood, and therefore we need to update our vaccination as needed. Vaccination is the most safest and the most convenient way to protect your health. It also protects you and the spreading the illnesses around. Let me just brief you on some of the common and the most important vaccination you need to take as an adult. First one is COVID-19. Like we all seen during the pandemic, how the viruses can spread all over the world, and there may not be many options of medicines or treatments available. And the only solution we can look for is a good vaccination. Therefore, a COVID-19 vaccination has been advised and recommended by the CDC and WHO to be taken by everyone, and they have updated the latest vaccine as well. FDA has approved a 23-24 version of the vaccine which need to be taken by everyone. Second vaccine is influenza. Influenza, which means flu vaccine sometime, is a H1N1 and its various variant called H3N2 and its lineages are being responsible for every year flu outbreaks all over the world, especially in the winter seasons, and which may turn out to be sometimes very serious complications in the form of pneumonias, hospitalization, even critical illness as well. Therefore, CDC recommend that everyone should get a one flu shot every year annually, especially before the winter. That is, the ideal time is September to October. So influenza vaccine is specially indicated in elderly people more than 65 years of age, underlying conditions in the form of heart disease, diabetes, asthma, COPD, and pregnant women, because they are more susceptible for the complications of the flu, and those travelers as well. And before the 2 weeks prior to travel, they can plan a flu shot. Third vaccine we are going to talk about is DPT or TDAP. DPT is usually taken as a common vaccination program in all the childhood. Some people, they might have missed it, and therefore the CDC recommend that those adults who have never got any DPT during childhood can take one shot of TDAP anytime in their childhood, and followed by one booster every 10 years. Also, those who have got a DPT vaccination in childhood can get a TDAP as a booster in their pre-teens, that is 11 to 12 years of age, and then can update their vaccination. Third group of the people who should get a vaccination booster is the pregnancy. So in pregnancy, third trimester is a time when TDAP booster to be taken by the pregnant women. So fourth vaccination which we are going to talk is very important, called HPV vaccine. Human papilloma virus is one of the very common cause of the cancers which develop later in the life, both in women in the form of CA cervix, CA vagina, and in men CA penis. And vaccination has shown being 90% effective in preventing these cancers if given on the right time. Therefore, the CDC and ACIP has recommended that everyone should get a human papillomavirus vaccination before the age of 26. It can be started giving as soon as 9 years of age. Between 9 to 14 years of age, 2 doses are recommended, 6 months apart. After 15 to 25 years of age, you can get 3 doses. And after 26 years of age, if you're at high risk, you can speak to your doctor about getting a shot. Fifth vaccination we're going to talk about is hepatitis B vaccination. Hepatitis B vaccination also has been inculcated into a routine vaccination program during childhood. However, a lot of people are not aware of the hepatitis B vaccination, and why is it important? Hepatitis B virus is one of the leading causes of the chronic liver damage in the form of permanent scarring of the liver, which eventually lead to the formation of liver failure, hepatocellular carcinoma as well in some cases. Therefore, vaccination plays a very important role to prevent such complications and serious illness later in the life. CDC recommend that hepatitis B vaccination can be taken any time of the lifetime in the form of 3 doses, 0, 1 and 6, and especially before the 60 year of age group. And after that, vaccination especially indicated in those who have underlying conditions in the form of kidney problem, diabetes, patient going for dialysis, heart diseases, so they should get vaccination updated. Next vaccination which we are going to talk is shingles vaccine or the herpes zoster vaccine. Herpes zoster is a reactivation of the chickenpox sort of virus. Same virus which causes chickenpox get reactivated and later lead to the formation of the painful rashes in the body, which is sometimes may state a painful neuropathy as well. Therefore, the vaccination CDC recommend that more than 50 years of age you should get your shots of shingles vaccine in the form of 2 shots. Especially those who have weak immune system, they should definitely go for the vaccination. Last vaccination we're going to talk about is a pneumococcal vaccination. Pneumococcal is a pneumococcal bacteria basically which contributes to the major burden of the pneumonia, sinusitis, otitis media and sometimes meningitis. And the vaccination can protect you from more than 100 serotype of the pneumococcal infections. Therefore, it is specially recommended in the people more than 65 years of age or those who have underlying lung problems, especially the bronchial asthma, COPD, etc. Keep your vaccination updated. Meet your doctor at Manipal and stay healthy. Thank you.